People are like, some people, that'd be their dream, spend 12 weeks in bed. Not mine. Just, yeah, it's brutal.
Allan Chambers' battle scar will show you when it comes to foot pain, he knows a thing or two.
So it goes from there all the way around there and then back up there.
He was on a hike in June 2020 when he jumped onto a rock.
The rock I landed on was on an incline, so my foot hyperextended and I landed all my weight on my right foot. And felt this excruciating pain.
Life got hectic and Allan put off checking it out.
I run a company and I'm too busy with work, so I kind of figured, well, I can't afford to have time off.
That's until he re-injured it and eventually had to get surgery last February, which revealed an unpleasant surprise.
So they cut me open and I had 2 torn tendons, impact fracture on my tibia, and there was a piece of cartilage that was causing a problem.
That meant trading his car keys for this knee scooter.
Pretty good on this now, I can do tricks and all sorts.
For 3 months. And Allan Chambers isn't alone. Medical experts say they've seen an increase in people deferring their care throughout the pandemic.
When they get scared, they will punt their surgeries. And that does cause a little bit more of an increase in the severity of the injury. I'm just going to do some basic stretches.
Andrew Marini is a PT and athletic trainer. He says foot health can have a domino effect on other parts of your well-being.
Having that out of whack will kind of affect the knee. It moves up the chain, can affect the hip.
Some experts say pandemic-related lifestyle changes, like walking around the house barefoot while working from home, may also be adding to foot issues.
You get used to a situation where you can wear your pajamas to work and you're not wearing any shoes and you're walking around on the floor most of the time and you're not exercising as much and you're probably snacking and gaining a little weight. You got multiple factors that can kind of contribute to that.
For all these reasons, both Andrew and Allan share this message.
My foot swelled like a football and I ignored it, and I know now, if you don't normally get a swelling there, do not ignore it. Get it looked at properly.
This is the new tool. It's a pre-treatment, meaning it is meant to keep people in a certain group from getting sick. And it was discovered and developed right here in Tennessee.
It was a very, very exciting day for me.
Caroline Davis is the first recipient at Vanderbilt of the newly approved shot to prevent COVID-19. She's being treated for cancer, which has hit her immune system hard.
And it's been pretty much homebound for the past year. So this gives me a little bit of confidence that I can go out.
Vanderbilt's Dr. Robert Carnahan discovered the antibodies in the shot called Evusheld. Dr. Carnahan says Evusheld is currently the only antibody combination given with the shot to prevent people from getting COVID-19.
And these 2 antibodies neutralize the virus. It means that it inhibits its ability to infect cells.
Just like the other antibody treatments already being used, after people get sick, there is not enough to go around. Evusheld will be given only to the highest risk patients, including transplant recipients and those being treated for cancer, like Caroline.
We have protective levels of antibodies and other things. There are a subset of people, and this is millions of people in the United States, who just aren't able to effectively respond to the vaccine.
Vanderbilt received some of the first doses in Tennessee. The state got a total of about 1,000.
I was just so grateful to Vanderbilt for developing it.
Why is this so important for patients like Caroline? She got 2 doses of the vaccine, but her own antibody levels didn't respond because chemotherapy weakened her immune system so much. As we see a significant surge in cases right now, one pharmacist says it's only the beginning of a 3rd wave here in Chattanooga, and with this increase comes the need for treatment. Access Pharmacy has been giving patients the monoclonal antibody treatment for months, but now the number of people who can get the treatment is being limited.
So there are certain qualifications that patients must have in order to qualify for the treatment. So high-risk medical categories such as diabetes, hypertension, things like that, as well as anyone 65 and up.
Jake Stanford says one of the hardest parts of the supply strain is turning people away who aren't eligible.
There's been a few, but mainly what we're dealing with right now is the supply issue. So there's only one monoclonal antibody that's effective against the new Omicron variant. It's called sirolimus.
But that's not the only tool to help COVID patients from becoming severely sick. As far as the status of the COVID treatment pill that the FDA just gave emergency authorization to last week.
We're hoping to have a shipment of it in the 1st of January, but we will see. So it's going to be very limited to start, and for what I'm hearing, it's going to be similar to the antibody treatments for qualifying.
Stanford says they are following the guidelines of the National Institutes of Health in upholding the current restrictions.